Good morning. So today I'm going to address something that's been in the news a lot, and I think I have a unique perspective because I'm kind of the victim and the villain in this situation. And I just realized I'm sitting right in front of the window. I'm going to move over a little bit away from the window. Sorry about that noise. So, actually, I think where I was a little bit better. Sorry about that. So, let's talk about Luigi. I actually, I'm an insurance agent, and full disclosure, I used to be appointed with United Healthcare. I am not now. I'm a captive agent for another company. I am not going to say which one because that is my personal work information, and I don't care to divulge that on YouTube. And I had clients that I signed up for United Healthcare policies, and I later enrolled them in other companies because I did not feel that they were disenrolled from United Healthcare, and I think that's about as much information that maybe more than I'm allowed to say. And I think their needs were better met with other companies. And this is kind of getting exactly to the heart of what I think is not being discussed in the news. You know, it's kind of going around in the news that this guy had back problems and that he was not getting his healthcare needs met. This guy was a millionaire, and that that maybe it was an act of whatever that begins with a T, ERR, and CEOs are afraid, blah, 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 blah. It's being censored by mainstream media, and nobody is discussing the big giant elephant in the room. And that is, why was this rich guy enrolled with a company that focuses on people that are on Medicaid? And that is something that I knew about. Maybe it's different in Virginia, but in the state that I live in, that is almost exclusively the clientele that they focus on. In Florida is Medicaid patients. And there's something a little weird about that to me as an insurance agent that is not being discussed, and that is that people that tend to sign up for it because they have the opportunity to get extra perks. And I worked for a long time for another company in another state remotely that offered perks for people who have dual Medicaid and Medicare, and not having those kind of problems. And so that is an industry that is very common because 70% of all seniors end up on Medicaid. That's a statistical known thing among insurance agents, is that senior citizens often end up having to do what is called a Medicaid spend down. So that is an industry that's very hot because everybody wants to sell things to boomers and also people who are disabled. But the Medicaid spend down is a thing, and people want to get in on that piece of business. And what generally is done is that they sign up for these plans, and they, in general, and I'm not saying specifically one company or another, the customer gets a no copays on anything. or very low copays. And then they get a little over-the-counter card or an over-the-counter plus card where they can get food and other items. And I'm just speaking in generalities on this. I'm not describing a specific plan. So this is just kind of how it works. They get some kind of a card that they can use at a grocery store or a drugstore to buy food with it, or they can use it at a farmer's market. And the idea is to promote healthier lifestyle habits. And United Healthcare is very big on promoting those kind of plans. And the benefits vary from plan to plan and from company to company. So my question would be, why is this young, robust thirst trap of a young man, and he's very good looking, that's there have been a lot of TikToks about people thirsting after this guy. Why was he on a United Healthcare plan? And again, I'm not licensed in Virginia. I don't sell products in Virginia, and I am not appointed with United Healthcare anymore. So I don't know what they are offering in Virginia now. But why was he on a United Healthcare plan? And that is not being discussed. That's not being discussed by mainstream media, and it is not being discussed by all the people that are cheering him for what he did. And I'm not taking an opinion on that, and I'm curious about it. Why was he on that plan? Why was this very affluent young man on a plan like that? And I am not judging someone for being on that. I knew somebody from a very, very wealthy family who was bankrupted by medical costs from cancer. So this was a while back. So that happens. And I am not judging about that. It absolutely can happen. So that's a possibility, and I believe that if somebody needs those resources and the insurance is liable to pay for it, I believe that the insurance should pay for it. Some of you might be looking at my videos and saying, well, that lady, is pretty well off, or whatever. I don't own this house. I'm renting it. In theory, I should have roommates. It's just because, there were issues between the landlord and my roommate that I have the house to myself. My landlord could contact me tomorrow and say, I have someone I want to rent the other rooms to. So this is not my house. What you see is not necessarily what is going on. So that's, that just because things appear a certain way, the slide is bad. But just because things appear a certain way to you does not mean that that's what's going on. But, people have commented that young man's family is very affluent. So the idea that he is on a Medicaid plan kind of makes me wonder how he was able to qualify for it as an insurance agent. It makes me wonder about it. But again, I'm not licensed in Virginia, and I am not appointed with United Healthcare anymore, so I don't know. And those are questions people should be asking about that case that they're not asking, because everybody's focused on two things, is there a cover-up in the mainstream media? Maybe there is. I don't know. I have a journalism background, and, there absolutely are arguments that the news is not being objective anymore. I honestly I go to sources outside the United States for my news because I don't see a lot of objective treatment in the news nowadays. But they're not asking the right questions about it, and a billionaire would have a reason to be afraid about it, but are they really being good people? That's a question they should be asking themselves, if they're worried about security, instead of carrying their underage child as a human shield, maybe they ought to be hiring more security and behaving in a more ethical manner. That's I think we're in a state in our society where we're reverting back to the times when we had robber barons in the late 1800s, and the economy became very unstable during that time period. I took AP American History. I did very well in that class. I did very well on that exam, and a lot of that coursework had to do with what was going on in the late 1800s, or the United States had a very unstable time period back then. I would encourage you to read books about what happened back then. It was very unstable. And it touched every level of society. It touched czars, it touched presidents, it touched robber barons, and, people should not behave in a manner that is evocative of that time period, because that did not have a happy outcome for anyone. But behaving in an ethical manner is another issue. The news is not really covering what needs to be covered about that, and everybody's letting their emotions cloud what really needs to be asked about it. And maybe what we're seeing covered about that is not exactly what's going on either. That young man maybe was not acting for reasons that people think he was. He released a manifesto. Who else released a manifesto? It was the Unabomber. And people that do things like that have their own ulterior motives, and they're not always working correctly up there. And it's not because they had a back pain that was not being treated. It's because there's something up there that's not working properly. And I'm not saying that to protect some CEO. I'm not saying that because I'm an insurance agent, because I also am a cancer patient. And I also have to make sure that I follow rules to get my treatment covered. I have to get referrals to get my treatment covered. I have to obey those rules. And you know what? My mother was a Dutch citizen. I have the option. I've already gotten in touch in case I decide to do that. I have lived in other countries that have national health care that is semi-privatized, just to be accurate about that. I've lived in 2 other countries that had that system. And what we are glamorizing in the United States about national health care in the Netherlands, in Israel. In Israel, I paid $1.25 every 3 months for my national health care. I don't know. Sorry. I don't know what it is exactly in the Netherlands. It's not free. It's not expensive. But it's not nearly what it is here. It depends on how early I'm able to find work over there. And but it's not free. I'm sure it's a lot less expensive than it is in the United States. But there are a lot of rules that you have to follow when you live in another country. You don't prance in there and go, I want to see the doctor over there because I think that doctor is better. You don't get to do that. And you don't get to say, that doctor didn't give me the result that I wanted. I want to take this medicine. No, you don't get to do that. You want to do that? You hire a private doctor and you pay for it yourself, or you find an organization that's willing to do it. You want to see a diabetes specialist in Israel? Good luck. 6-month wait. And guess what? In Israel, everyone has diabetes. Netherlands, doctor's going to tell you to take Tylenol and go sleep it off. I have a cousin who is going through cancer treatment right now, first cousin. And they sent him to the cancer center. Yeah, he's staying there. And, he's basically going through the exact same thing that I'm going through. And he's going through chemotherapy, just like I am. And, yeah, he's got nurses to take his trash out. I don't. And, the flip side to that is I get to sleep in my soft, comfy bed. He has to sleep in a hospital bed. I have my surroundings around me. Yeah, I work, but you know what? I kind of like the work. It makes me feel like I'm contributing to society. Maybe, he's a little older than I am. He's retired. I'm not retired yet. I'm 55. I would feel kind of useless. I mean, that's just my temperament. If I no longer worked, I'd probably write books or something, but I would feel like I'm no longer part of society if I didn't work. That is just me. That's, and I'm sure a lot of people would be like, oh yeah, I'd love to do that, but really, if that would make me kind of sad to be in that kind of a situation and everything. It's hard for me being alone in here, and it gives me a social outlet, to go on Teams and communicate with my coworkers, and to get these calls of people who need my assistance to get their health insurance. That's something that gives my life some purpose and everything. So there are differences in everything, and I'm not saying one is better than the other. I'm saying maybe it's not what you think it is. Things are not always what they appear to be. And, if you think that everything's going to be glamorous and everything, if you have free health insurance, you're not going to get free health insurance. It might cost you $1.25. It might cost you $5, which is a whole lot less than $100 a month or $200 a month, whatever you're paying for it. And you might not have any co-pays or whatever, but you also have a trade-off with that too. Your doctor might tell you to go sleep it off, not give you your tier 3 drug that you wanted because you saw it in a commercial. And yeah, they don't have commercials about that stuff overseas because government's not going to pay for it. You want that stuff, you're going to have to pay for it. It's not free. It's not covered either. You want it, you have to pay for it yourself. And that is how things work when you're in another country. And People don't ask the right questions about what's going on with that. And getting back to the original topic, I don't think people are asking the right questions about Luigi. And that is, why did he do that? Why was he on a United Healthcare plan in the first place? How did he end up on Medicaid if he was on Medicaid? Which that was the first thing that I wondered about, was why was he on United Healthcare? But again, I'm not licensed in Virginia, and I am not appointed with United Healthcare anymore, so I could be way off on that. But that's what that made me think of. And don't trust somebody that writes a manifesto. That's kind of a sus thing in my book. And I am not somebody that sides with billionaires. It's, I don't like a person who uses a child as a human shield. I'm just saying we need to ask the right questions. So that's my opinion as an insurance agent who has cancer and knows how to use my health insurance plan the proper way. You have to follow the rules on that. And if you follow the rules, a lot of times you'll get what you need. Might not be what you want, but it's what you need. So, sorry to get deep and serious and all that, but I think I have a perspective that a lot of people don't on this topic. So, I need to get this uploaded because I do have to get to work in about an hour. So, have a good day. And tomorrow I will be talking about something a lot more lighthearted. And bye-bye.